Hi, my name is John Gibbons, and in this video I'm going to teach you how to apply K-tape to the lumbar spine. With this patient I've already placed a couple of stars to indicate where the pain might be, and obviously if the pain is higher or lower then we can apply the tape accordingly. For this demonstration I'm going to use two bits of tape, the two standard eye strips, and which I've already pre-rounded the ends, and this tape is what we call the Big Daddy tape, or the 10 centimeter tape, and Rocktape sell this tape. And what we're going to do is, first of all, if the patient has pain here, they place their hands onto the mid-thigh and then they just slowly slump as far as comfortable. Remember, if they got pain, they might not want to go very far. So we'll go as far as she feels it's okay, and then the hands support the weight. They can stand if they prefer, but this is where we're going to start with this video. Now, what we're going to do is, I'm going to split this tape in the center and then peel this back. So I'm going to peel it back a little bit, either end. And then what I'm going to do is apply the central part of the tape to the central part of the spine, making sure that those stars are covered, and stick down that first part here. And then what we're going to do then is peel it back to almost the end, lock it down, tension it. I'd suggest about, there's 100%, there's 50, around 50 to 75, across the area of the lower back, and then just feed it under the trousers there. And the same on this one. I'll peel it back a little bit, tension it 50 to 75%, and across the lower back area here, and again just tuck that under. And then just for a few seconds you can just heat activate that tape, and to be honest that would be okay. And if the patient was to sit up, then you might notice there's a few creases that form within the tape. Now if we just go back to where we were in flexion, I am going to continue using the two small strips, and then this just offloads the lumbar spine erector. With this one we tend to split at the end, and we have a choice. We can either peel that off. If I peel it off, it means I'm going to contact the adhesive. So in this case I'm going to keep hold of it and apply that inferior to an area called the PSIS, which is the posterior superior iliac spine. And then I'm going to lock it down and then pull it, and then that causes the tape to lift. And again I'm going to tension it. There's 100, there's 50, there's 75. So 50 to 75 across the lumbar spine. And there we have it here. You notice that she just applied a bit of flexion. So ideally we would tape with the patient in a little bit of flexion, as long as it's not too painful. The second one, again, same area, just below the PSIS. If you lock it and pull it, the tape will lift. Peel it back. Again, tension it, 100, 50, 75. And then apply that to the area. And then what we would do then, just for a few seconds, heat activate. And then the patient can then slowly come back up. With a black tip it's hard to see the creases, but hopefully you can see them in the pink one here. And there we have K-tape application for the lumbar spine.